Hello, I am Jonathan Mason, and in this video I talk about pharmaceutical medications, the problem with them, and why we need them sometimes. Now, I'm not a doctor, so I must make this disclaimer, and I will see you after that. The biggest problem with pharmaceutical medications is they don't cure or reverse your type 2 diabetes. They attempt to manage your type 2 diabetes by altering how your body works. They have numerous ways of trying to do this, but they are not very successful as they do not tackle the primary cause. They assume that you are inflexible and are not prepared to change your lifestyle. If you haven't seen the video Understanding Diabetes, the link is in the description box below. But it is important to understand diabetes to know why the pharmaceutical medications are not achieving their objective. Most type 2 medications are oral medications, but some people have to have insulin injections. But here I'm going to discuss the oral medications. As I've already shown, type 2 diabetes is a result of your body becoming insulin resistant. Now, the goal of modern medicine is to help you use your insulin better, or to get rid of the excess glucose in your blood. There are 9 basic medication groups that the doctors use today to try and control your glucose levels, which I'll list over here to my side. Now, for you to reverse your type 2 diabetes, you don't have to know all the different types to understand fully what they do. So I'm only going to cover a couple of them. And at the end of this video, I will leave a slideshow so that if you are interested, you can pause it on the drug that you are taking and read it for yourself to understand what your medications are doing for you. But the first one I want to discuss is sulfonylureas. Now, the list of medications in this group is over here beside me. Now, glipizide was a drug that I was prescribed. I had been prescribed other medications before this one, but none of them agreed with me. These medications are amongst the oldest diabetic drugs still used today. They work by stimulating the beta cells in the pancreas, which then causes the pancreas to make more insulin than it normally would. So the objective is that if you give your body more insulin, there will be more stimulation on your cell walls, which should increase the rate of transfer. But this leaves your body with excessive insulin, and this results in hyperinsulin, which is a catalyst for various other complications. The problem with this is that it doesn't tackle the real cause. Your body still remains insulin resistant, and the reason that your body has become insulin resistant is not being addressed. Now, it's still allowing you to bombard your body with foods that are the cause of the problem, and it gives your body little or no time to recuperate. This, in fact, just compounds the problem, and your resistance to insulin increases. Now, the next group of medication I want to talk about is the biguanides. Now, here's a list next to me of these medications contained in this group. Now, biguanides decrease how much glucose your liver makes. They also decrease how much glucose your intestines absorb. Plus, they make your body more sensitive to insulin. Now, the most common biguanide is metformin. Now, metformin can be combined with other drugs. This is the drug, the go-to drug for most doctors, as it does try to address the problem of the sensitivity of the insulin, and it is a drug that is believed to have the least amount of harmful side effects. But what it also does is interfere with the organs that are working well in your body, like the liver, where it decreases how much glucose your liver makes. Now, this can result in further damage, as the body is a very complex biological system, and its interdependency is very, very pronounced. So fiddling with one part of the body can result in others being affected. This is one of the big reasons pharmaceutical medications have so many side effects. Now, metformin is heralded as being the best of the groups. So I will list the side effects on the panel next to me. Now, these are the same as you will find on that little leaflet that comes with your medications. They are vast in number, and some are very, very serious. Most of the drug groups work in similar ways, affecting different organs in the body, such as trying to flush out the glucose in your system or trying to control your appetite and how quickly your stomach absorbs food. But they all interfere in the normal function of the body, which is a sound and very efficient mechanism. None of them, save metformin, try to address the real cause, and metformin has had very limited success, as the real cause is not that the cells have become insulin resistant, but why the cells have become insulin resistant. So as you can see, none of these medications are designed to get your body to function in the normal manner. I suppose it's a bit like a plumber trying to fix a leak in a water pipe, but instead of fixing it, he puts a gutter under it so that it can take the water away and deposit it in a drain elsewhere. This appears to have solved the problem, but it has not. The leak was still there and it's getting worse. And if the gutter fails, the problem will be worse than before. Pharmaceuticals have failed to prevent our bodies from becoming insulin resistant and have done everything to allow us to continually bombard our bodies with the foods that have caused our bodies to become insulin resistant in the first place. So the medications are designed to allow us to work against the good of our bodies. Now, if we continue to consume excessive glucose and processed foods that our bodies are struggling to recognize, this leaves us continually hungry, and as a result, we continue to gain weight. This in turn means that we become more and more insulin resistant and require more medications year on year. This is a downward spiral of worsening health. The doctors are advising us to control our diets, but they are not giving us a scientific means with which we can work with. We don't really know how to work with these diets, and they are not explaining that to us. Now, I'll cover which diet is best for a person with type 2 diabetes in a later video, but this is where this dilemma comes into being. If we should be controlling our diets whilst on medication and still not reversing it, then why not control our diets properly and have no need for the medications in the first place? So the dilemma of to diet or not to diet becomes a logical choice. I think it's an important decision to make before you accept that medications alone are going to cure you without you having to do anything apart from taking a handful of pharmaceutical medications every day. So if you're not prepared to correct your type 2 diabetes by changing your lifestyle choices, it is always preferable then to see the doctor and take the prescribed medication, as the consequences of not treating your type 2 diabetes at all can lead to serious health risks. So I'm not advocating in any way whatsoever that you should ignore your doctor's advice or ignore the medication. What I will be advocating is a better way of introducing a healthy diet and exercise into your treatment that will eventually eliminate the need for pharmaceutical medications. So let us have a look at what risks you are facing if you don't treat your type 2 diabetes. Now, I'm not going to be listing them all, but they can lead to things like heart disease and stroke, nerve damage, diabetic retinopathy. This is where the retina at the back of your eye becomes damaged, and it can cause impaired vision and sometimes blindness, kidney disease, foot problems, sexual dysfunction, where you lose your loss of libido and failure maybe to reach an orgasm, miscarriage and stillbirth. So as you can see, this is a very serious disease, and it is not one to be taken lightly. Plus, there are a lot of other problems that are associated with untreated diabetes. Now, as can be seen, there are a lot of side effects that pharmaceuticals, but they are still preferential to the problems you will have if you do not treat your type 2 diabetes. Now, if you had some more of the serious sort of side effects, your doctor might put you on a different drug until they could find a drug that might be a little more compatible with you, one that didn't have too many side effects. But failing that, they would then try to prescribe something that would combat the side effect of the drug which you were taking. Now, if you follow this through to its natural conclusion, this can lead you into taking a whole handful of drugs every day. Not a very desirable situation to be in, as the more drugs you take, the more potential side effects you're exposed to. But sometimes, we don't have the choice, depending on how far our disease has progressed. So the sooner you change your lifestyle, the better for you. No matter how far along you are, you can still change your lifestyle and halt that type 2 diabetes and reverse it some ways back. So the sooner you change your lifestyle, the better it is for you. You may be asking, why is it important to know all this? Well, it is important because if you are set on changing your lifestyle, you are going to have some challenges. And I want you to be fully aware of what you are leaving behind. Because as you reduce your dependency on the pharmaceutical medications, you will begin to experience a lot of changes in yourself that you might have thought were just normal. When they begin to fade away, you will realize that you don't have that blocked nose anymore. You are sleeping better. Or you don't have that indigestion anymore. You don't have that sore feet. You're not getting depressed anymore. You will know why. It is because of the healthy eating and because you're not on those pharmaceuticals anymore. Because as we consume more and more pharmaceutical medications, it is easy to blame our problems on just getting older or on the disease itself. Now, if we didn't have the disease, we wouldn't need the pharmaceuticals. So they do go hand in hand. By changing our lifestyle choices, we can put ourselves in that position where our bodies are functioning as normal, healthy people. Even if you're not able to come off your medication completely, you will have at least minimized the exposure to them and would have given yourself the best fighting chance of living a healthy and more energetic lifestyle, and would have halted the need to keep increasing your medications because you will have learned how to manage it. But here's my best advice. Don't just follow me, but be a student and look at what I say with an objective mind and take from it what you consider valuable. It is your life, it's your battle, so fight it the best way you can. What I'm putting out in these videos is what has worked for me. My guess is that because we share the same disease, our physiology can't be that different. So arm yourself with the knowledge that you need to reverse your type 2 diabetes. You see, what you don't know can hurt you, especially with type 2 diabetes. All my videos on this program are free to look at. I give you the exact diet plan that I followed and the formula for you to calculate your own meal plans. I also give you the information on how to go into the diet safely and to avoid some of the experiences I had and how to come out of it safely. There's also advice on how to manage your diet and accordingly your diabetes once you have stabilized. I give you advice on what to look for as you grow older and maintain that self-rewarding health. Reward yourself with good health and change your lifestyle like I did and enjoy more vitality and experience the joy of living life. I want to thank you for listening to Pharmaceutical Medication, Good or Bad. Please go to my website and check it out. All the videos there, which have a little description next to them of what each video is about. Now, in my next video, Diabetes and Diets, I talk about diets and how they affect the type 2 diabetic. Understanding the different diets will help you draw the best information that they offer. So please join me in my next video, Diabetes and Diets. If you would like to help me reverse type 2 diabetes around the world, then please like, subscribe and share these videos. But if you would like to get more involved in helping me to spread the word in a more direct way, then please go to my website where you can find the program's mission statement along with a complete set of videos and a whole lot of other helpful aids that a type 2 diabetic could need. It is also a place where I hope to build a supportive community environment. Now, I would like to thank anyone in advance who graciously donates to the cause and shares these videos. It is this support that enables this information to reach more people and to change lives. Have a wonderful day. Bye-bye.